Well, good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Tuesday, July 19th, 2022. And our top story today, children's vision problems often go undetected. Well, joining me now to discuss this and a lot more is Dr. Olivia Killeen. She's a National Clinician Scholar at the Institute for Healthcare Policy and Innovation at the University of Michigan. Dr. Killeen, so great to see you. Thanks so much for joining us on the program this morning.
Thank you so much for having me.
All right, let's talk. I want to talk about vision, and I'm not talking about the long-term vision of a project. I'm going to talk about how important it is for us as adults to be able to help children with vision diagnoses. And I know you and the team at the University of Michigan did a lot of research around this. First of all, are we properly diagnosing our children's vision problems and vision needs?
Unfortunately, right now, there are still a lot of needs. Visual impairment is actually the #1 cause of disability in kids, and it's estimated that 1 out of 4 kids has a vision problem that either hasn't been diagnosed yet or hasn't been treated. So we have this huge amount of kids with vision problems, but unfortunately, only 1 out of 5 US kids is getting their vision tested during the preschool years. So we're missing out on a really important opportunity to diagnose these problems early when we can still treat them.
Dr. Killeen, let me ask you, when we're we're developing, sometimes it's hard for the child to communicate. And I was relaying a story that I had when I was a young boy. Actually, my grandmother noticed something about my vision. I think I complained to her about something. I was 3 at the time. How important is it for adults to kind of pick up on children, whether it's teachers and administrators or parents or loved ones, on the needs of the child?
It is really important. And you're actually a really lucky kid because most kids aren't even aware that they have vision problems. They're born with the eyes that they have. And so to them, their vision seems normal. And that's why screening kids for vision problem, meaning testing them either in school or at the primary care doctor's office, it's so important because most kids aren't going to be able to tell us on their own that they can't see well.
And you talked about impairments. And, if you have, I think for me, I had an astigmatism. I had some blurry vision. Again, this is going back over 40 years. But a lot of these things can be treated. And in your line of work, ophthalmology and the research, there's so many different ways to treat these impairments, and it can set up the child for success in their future life.
That's so true. The #1 cause of vision impairment in kids is simply needing glasses. And that seems like such a simple problem. Just give them glasses. But there's a whole kind of host of issues that are interfering. One is early detection. If kids aren't detected early for vision problems, they can actually develop permanent vision loss called amblyopia. So basically, if you're not seeing sharp images during childhood, the connections between your eye and your brain don't form properly, and it leads to permanent vision loss. So after the age of 10 or 12, kids who have amblyopia are no longer able to have any improvement in their vision. And so if we don't diagnose these problems on time, kids go on to a life of visual impairment. And that means not doing as well in school. As they grow up, they're less productive in the workplace. They have more car accidents, and even things like increased rates of depression and dementia. So for a child's whole life, if we don't catch them early, they can have a tremendous amount of problems from visual impairment.
Last question for this segment before I go to a commercial break. The COVID pandemic had a lot of impact from a financial perspective, of course, a healthcare perspective, but one of those things were a lot of people, my grammar's bad, but a lot of people weren't able to go to a practitioner, whether it's an internist, whether it's an ophthalmologist, a dentist. This has the impact that you're talking about with children. They didn't get tested because they weren't in school.
That's absolutely right. The two places that US kids get tested for vision most commonly is in school, at school screenings, or at the primary care doctor, getting screened by their pediatrician or their family doctor. And so during the COVID pandemic, when schools were closed and people were avoiding the doctor, that meant that a lot of kids weren't getting their vision tested.
Yeah. Well, Dr. Colleen, I need to take a quick break, and when we come back, we'll talk about some tips to help your child get their vision tested, I should say. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you over 50? Would you like to get up to 33% more income in retirement? Then call now for this free book, Annuity Do's and Don'ts for Baby Boomers. This free book reveals little-known secrets about annuity strategies that will help you make the right choices before buying an annuity. Call right now for your free book, and as a bonus, we'll also throw in a free annuity rate report, both absolutely free for calling Annuity General today.
Call 800-504-8194.
Welcome back. We're talking your eyes and your children's eyes this morning. Joining me back again is Dr. Olivia Colleen. She's with the University of Michigan. She's an ophthalmologist there and a national clinician scholar. Dr. Colleen, thanks so much for sticking with us this morning.
Thank you.
Okay, so let's pick up the conversation. Getting tested, as you said, very easy. And this is something that you can go to a ophthalmologist that works with children, right? I mean, this is not, that has the experience. I mean, a lot of us have experience going to an ophthalmologist. We get our eyes dilated, we get them tested, but there are specific ophthalmologists that work with children.
There are. So most kids just need their vision tested at school or by their primary doctor. But kids who have eye problems should follow up with a pediatric ophthalmologist or an optometrist to do more advanced testing and see, do they really have a problem? And if so, how do you treat it?
And when we talk about coverage, because a lot of times people are often concerned, hey, I don't want to go to the doctor, or I don't want to take my kid to the doctor because there's an out-of-pocket cost. And look, these are difficult times for all of us with inflation, gas prices, food, etc. But a lot of what we're talking about today, that test is covered by private healthcare insurance as well as Medicare, and I think Medicaid, but you'll confirm that.
Yeah, so for children, the Affordable Care Act made vision services an essential benefit. So basically, you don't need special vision insurance to take your child to an eye doctor. It's covered by medical insurance for the vast majority of children.
Yeah, and just going back to the testing time frame, and I know you hit on this in segment one, but I just want to remind the audience, if you've got children, young children, really it's that 1 to 5 year old or 2 to 5 year old, that kindergarten age really is that sweet spot for getting tested.
Yeah, ideally, kids should start having their vision tested when they're 3 years old, if they can cooperate. And then certainly at 4 years old and 5 years old, almost all children are able to participate in reading the eye chart at that point. And those preschool years are so critical because treating vision problems is much more effective when they're so young. As they get older, more to elementary school or middle school, that window of opportunity to treat problems before they become permanent, that window closes.
So to do the eye test, do I need to know my ABCs and my 1, 2, 3s?
No, luckily you don't. We have so many tricks of the trade that we can use. Even in a squirrely 3-year-old who can't read any letters, there are still ways that pediatric ophthalmologists can check their vision and even prescribe glasses if necessary. And so no worries, even if you don't think your child can participate, chances are we can get them to participate.
Yeah, and that's what I was saying. I mean, you and the team in your University of Michigan, you could do a lot of research around this. There are all different ways to figure out whether a child needs glasses and what they're actually seeing. I mean, of course, looking into their eyes using that refractive technology, I think it's called. But there are all sorts of technological advancements today that can measure your iris and look into your eye and take appropriate measurements. So whatever the child says is maybe not as relevant as when I was a child.
It's true. It's true. Even by shining a light into a child's eye and holding up different lenses, we can look at the reflex, and based on that, we can find out what the perfect glasses prescription is, even in a kid who can't talk to us.
Because I still have problems, by the way, Dr. Colleen, when I go, the doctor flips the lens when you're looking through that device, trying to figure out, dial in your prescription. I can't figure out if, hey, is this one better? I'm always afraid I'm going to get the wrong answer.
I know what you mean. It causes a lot of anxiety, but luckily in kids, we don't really even need them to cooperate that much.
Well, Dr. Colleen, I really want to thank you so much for joining us. I think really important information that we're relaying to people, especially if they have children or loved ones, the young loved ones, how to prevent long-term impairment. Dr. Colleen, thanks so much for joining us, and we look forward to having you back on the program again very soon.
Thank you so much for your time.
And that wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to, drop us a line. And don't forget, for all the latest curated news in lifestyle, wellness, finance, tech, so much more all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? Well, visit our website and, of course, our streaming partners. We're back again tomorrow for another edition of BRN AM. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the First Lifestyle and Wellness Network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate your tax bill and reduce your stress. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will work with you using our years of experience to represent your case to help you get the best resolution under the IRS guidelines. Help is here to deal with the IRS to reduce your stress. We've handled thousands of cases, so we know what we're doing. If you owe $10,000 or more in back taxes, do not call the IRS alone. Call a Tax Doctor now for a tax emergency analysis.
Call 800-224-6439.